We are a statewide network that brings together partners in order to support access to healthy foods and safe physical activity environments. So we have partners who are working on the ground, and then wonderful professionals who work in a wide variety of organizations, which we'll hear from in a moment. And we just connect resources and ideas and just engage as a network to move this work forward. So it's a great group of people who come together to do that. So this is just our mission. We really exist to align state and local efforts around food access and safe physical activity environments. So we love to just connect, and not only as professionals, but also with communities. And we really want everyone's voices to be heard, especially those who might be on the SNAP program or who might be receiving SNAP Ed services or any of the services our organizations serve. We want to hear from people and know that the work that we do is helpful. So that was a quick overview of SNAP Ed and the SNAC program. If you ever want to learn more or go into a deep dive, feel free to email me. I'm always happy to do like small networking calls about what we do. We're a very passionate group. But we will go ahead and move along to our wonderful panelists. So we have 3 panelists today, and I'll let them introduce themselves, and we'll go through, and we just have some questions that they're going to answer that would be helpful. And like I said, we're going to end with some questions in networking. So panelists, if you want to go through and just start with your name, your organization, your job title, and how long you've been working in your current role. We will start there. So we'll start with just how it is on the screen. We'll go with Hannah, Elise, and then Sarah. And then I think we can just continue that as just a pattern here. That sounds okay with you all. Yeah, all right, well, go ahead.
Hi, everybody. My name's Hannah Kelly, and I am a registered dietitian with the American Dairy Association Indiana. So I'm the director of health and wellness there. And I have been with dairy, it'll be 7 years here in about 2 weeks.
Hi, I am Elise Gahan, and I am a registered dietitian at the Marion County Public Health Department and the Chronic Disease Department. I am the Nutrition Incentive Project Specialist, where I manage our Fresh Bucks program, and I am 2 days away from my 3-year work anniversary right before COVID. So I've been at the health department for about 3 years and in this current role for about 2 years.
And hello, everyone. I'm Sarah Wilson. Happy Ash Wednesday and start of Lent to anyone who's celebrating that. I am a registered dietitian and the nutrition manager at Gleaners Food Bank of Indiana, and I've been there somehow for 5 years already. And I love every minute.
Time flies when you're having fun. All right, I'm going to stop sharing the screen here, and that allows you all, as panelists, if you want to share anything to help explain as we move on, feel free to just go ahead and share your screen. But one thing we wanted to start with was just your current role in your organization. So if we want to go through, if you all would just explain your organization and what you specifically do in your role, and then any day-by-day things that you would do. And everyone, if you have questions as we go along, feel free to put them in the chat and we can just answer them in real time as well. Go for it, Hannah.
Yeah, okay. Well, as I said, I have been at the Dairy Association for almost 7 years now. I came to dairy, I guess just as a fan. I like to eat dairy foods, but I was the executive director for the Indiana Academy of Nutrition and Dietetics for 6 years before that. And I did some clinical work in long-term care and hospital settings and group homes and a variety of things. But this position opened up. It wasn't always a dietitian that did the job. And when it opened up, a friend of mine who also still works at dairy, she said, I think this is something you might be interested in. I just really had this love for learning more about where my food came from. So as dietitians, we talk about like what we should eat and how much we should eat and all the things. But knowing like that root where it is coming from was really valuable to me. And my grandparents were farmers, so I kind of have a soft spot for farmers. And working for the Dairy Association kind of allowed me to do both. As an organization, there's a National Dairy Council, and it's been around for over 100 years. I know, so Julia mentioned just a little bit ago that SNAP Ed comes through the USDA. Well, the Dairy Association is also overseen by the USDA. So it's not something where we're funded by the government. We're funded by dairy farmers, but the USDA kind of oversees all of the information, the nutrition education pieces we do. So my role from day to day really is to translate that nutrition science into smaller bites for the community, for schools, for other health professionals, to help them to understand better how dairy gets from the farm to the refrigerator or to their school, wherever it might be, but also to learn that nutrition science piece. So what are the essential nutrition pieces that come from dairy foods? So we have to break that down so that, you know, we can communicate a message to people in, especially now, you know, in the past we would give somebody a handout or maybe do a talk or a presentation, but from day to day now, we might be helping to make little videos that can go online. We have a YouTube page and a website and Facebook and Instagram and Snapchat and all the things to try to make sure that we are conveying that nutrition message. But then additionally, because a lot of people aren't really connected to farms anymore, we talk a lot about where dairy does come from. So sustainability on dairy farms, animal care, you know, how it actually, all of it happens, you know, getting from that farm to fridge. So every day is a little different for me because we're always trying to find a way to be able to share the information. Dairy farmers they work 24/7, 365 days a week. So they really don't have time to go out and tell people about what the nutritional value is. So that's my role. We kind of work in 3 bucket areas, we say. So there's dairy nutrition, which is under myself. Youth wellness. So if anybody on the call has had Fuel Up to Play 60 in their like K through 12 education, you've maybe heard about it there. Plus dairy is part of the National School Lunch and National School Breakfast programs, also kind of under that USDA wing. So we share information about that, and then the dairy farming piece. I'm just trying to connect people. So I might be leading a group of students on a dairy farm. We might be doing a virtual farm tour. I might be doing a presentation somewhere. So every day is fun and exciting at dairy.
Great. Thank you so much for sharing. All right, Elise.
Yeah, so I am in, like I said, the chronic disease department of a local health department. So Marion County Public Health or Department covers Indianapolis. And so in the chronic disease department, we use what we call PSE or policy systems and environmental approaches to promote health behaviors. So while I'm a dietitian, I joke that I don't like telling people what to eat. Like that's why I did not go clinical. There's a time and a place for that type of education and medical nutrition therapy, but that is not my skill set. And so instead of kind of telling people, hey, you know, eat more carrots today, our goal is to create environments that promote those behaviors and make it easier. So maybe that's by being more affordable or more available, those type of things. And so in our department, we also have folks who promote smoke-free environments and work on tobacco cessation, as well as creating places for safe and active living. So bike trails, walking opportunities, kind of those health behaviors that can prevent chronic diseases or help folks who might have a chronic disease to manage them appropriately. So that's kind of our big picture department angle in the health world. And then for FreshBucks, so FreshBucks is what we call a SNAP matching nutrition incentive program. And so it is a program that is open to any person who is enrolled in SNAP. So real connected kind of that SNAP Ed world. Those are our same people we're looking at. And we provide a $1 for $1 match at farmers markets and certain grocery stores on fruits and vegetables. So we incentivize buying more fruits and veggies. So this is an evidence-based program based on lots of research that shows that low-income folks can tend to have a lower quality of diet, so they're getting fewer of those nutritious things, and there's lots of systemic reasons for that. And we also know that cost is the most significant barrier to purchasing those foods. And so our goal with this program is to, directly address that disparity in access and that barrier of cost by helping provide, an extra incentive to essentially get 50% off fresh fruits and vegetables. So my work is very much not, trying to get people to eat the right diet or saying you have to eat this way, but trying to address a barrier and create more opportunity for folks to engage in the health behaviors as they see that works in the diet that fits for them. So my day-to-day work to do that kind of also did it in little buckets. So I kind of have an admin bucket. So we at the health department administer this program for 14 different sites. And so that's boring things like making budgets and tracking purchasing and doing some of that. We facilitate different meetings with whether it be farmers markets or technology providers and working on projects in that way. Writing grants. I've gotten to learn a lot about communication efforts in my work, and so creating different messaging and outreach tools. And then working with sites. So we work with farmers markets, farm stands, as well as locally owned grocery stores. So that looks like creating training materials on how FreshBucks works at that site, and then training those folks. So we recently rolled out here in Indianapolis, we've got Safeway grocery stores. So the past few months, I've gotten to spend a lot of time with some of the cashiers there, just training them and getting them up to both speed and helping address some things there. And then also there's a lot of back end work that goes into being in a new site. So I've gotten to learn a lot about like point of sale systems at grocery stores and some of the technology of how do we make this program that can be described in one sentence, how do we make it work in real life? And then there's like an evaluation bucket. And so we want to make sure that we're being effective with our programming and that, our dollars are being used in a way that's helpful. And so we have a technology process for our checkout. So we're really lucky that all of our data is now digital. So there's no more hand counting things, which helps a ton. And so there's also a lot of opportunity for data analysis and kind of seeing, we know that there's a lot of high SNAC users in a certain zip code. Are we capturing them in FreshBucks? And so kind of able to do some quality improvement along that. And then the last bucket I just kind of called like PSE work. And so that's staying on top of the relevant literature. There's a lot of exciting things happening in this nutrition incentive space. And so, we learn a ton from friends in Michigan and Ohio and Florida. And it's really great to have that network of practitioners. We collaborate a lot. And so whether that's with the city of Indianapolis, we want to make sure we're on the same page with some of their programs. I get to meet with, Gleaner SNAP outreach folks and make sure that they've got handouts and things or give presentations with them. And then we're also hoping to grow this as a network across Indiana. And so, next week I'm meeting, we're working with a farmer's market in Noblesville this summer. And so I'm going to meet with their market manager and we're going to train them on how that works. And so kind of hoping to spread this equitably across the state. So those are kind of the buckets that my work goes in, and it's kind of seasonal ebbs and flows of lots of variation. And of course, next month, I'll be ramping up for summer markets. So it'll be a lot more focus on getting all that stuff in alignment. But yeah, it's fun to have the variety and get to flex lots of different skills along the way.
Thanks, Elise. Yeah, when we talk about food access and really being on the ground and helping those, specifically those who have SNAP benefits, get produce, get different foods, Elise's work is so vital in that. So thanks for your work, Elise. Go ahead, Sarah.
All right. Well, I get the privilege of working with these lovely ladies on a lot of different community partnerships. So I love hearing the ins and outs of their everyday work as well. So my work at Gleaner's Food Bank is primarily focused on promoting the health and wellness of the community that we serve, which is primarily food insecure individuals. So I'm sure you're probably familiar with the term food insecurity, but I thought I would define that here just in case. So food insecurity is a limited or inadequate access to enough food for an active, healthy lifestyle. So that can look a lot of different ways, and we keep learning more and more about just the barriers that so many folks are facing in light of the pandemic, in light of inflation, but really that's been happening all along. We've just kind of become more aware of the challenges that individuals and families face in either having those healthy food resources available in their community or getting to those resources. So our food bank brings in food from a variety of sources. We have farmers and growers that we get fresh produce and protein and dairy from. We have manufacturers and retailers that donate food to us or we purchase food from. And so we have a huge warehouse over by the Indianapolis airport where we can bring all that food in and then get it out in smaller loads to places like food pantries, soup kitchens, community centers that are kind of boots on the ground, community facing organizations that really know their neighbors and know what types of needs that they have. So we're kind of like a warehouse distribution center, if you want to think of it that way. We do have an on-site food pantry though, and then we also operate a lot of different food distribution programs. So that gives us insight on the individuals in our community as well. So we have a drive-through food pantry right now just because numbers have been continuing to rise with inflation. We're seeing a really big influx of people coming to Gleaners for food assistance. We'll serve currently anywhere between 600 and 700 households every single day that we're open, which is not a number we're proud of. It's just the reality that we're facing. We also have a home delivery program, a Gleaners to Go program, which is kind of like a online ordering for groceries. So if you use Kroger Quick List or Meijer Pickup or any of those types of services, we have something similar where you don't have to pay for the food. You can select a pickup time and location that's convenient because we're learning that food pantry hours are not always conducive with work schedules. So my role in all of those things, we do a lot of other programs and outreach as well. But my role is to kind of make sure nutrition is integrated in the types of foods we're providing, as well as pairing that with some education to help folks understand or feel empowered in using that food in nutritious ways to provide meals for their families. So I have a couple slides just from another presentation I did that I thought might help kind of show what that looks like. So go ahead and pull that up here real quick. Let me know if you can't see it. But this is kind of a breakdown of the work that I do in nutrition at a food bank. So we've got nutrition education, promoting nutrition at the food pantries that get food from us. I've done some work in a nutrition policy for our organization. And then I also work with our healthcare partners. So I'm not going to go too in depth on these, but just to kind of give you an idea of what this might look like in my day-to-day work. I have done mostly pre-COVID, but still a little bit here and there, some recipe samples. So informing people on how to use the foods you're getting from the food pantry. Sometimes things are really not familiar to people getting food from a food pantry. So this picture, I made a recipe with rice and lentils. So kind of common staples, but something not everyone knows how to prepare. And we also gave away some rice cookers at that demo. We host cooking classes on site with Indie Hunger Network. We do some kids nutrition education programs. And then I manage our Nutrition Hub website, which is a whole slew of resources, anything from handouts to healthy recipes, blog posts. We have cooking videos on there. And I work with interns from IUPUI and Purdue who help develop a lot of content for that website. So it's all kind of one place that our neighbors can visit, our partners can visit, donors, volunteers, whoever. It's a publicly available website. And then I also get the privilege of working directly with some of our food pantry partners who are doing amazing work in the community. And really, I just provide some resources and support so that they can educate their shoppers on nutrition and make sure they're providing really nutritious foods. And one way that we do that is we have been in the process of ranking our entire warehouse full of food. So if you picture like 3 football fields in size, that's about how big our warehouse is, like 4 stories of racks full of food. We're working on ranking all of that with this system called SWAP. So it stands for Supporting Wellness at Pantries. It uses some guidelines called the HER guidelines, or Healthy Eating Research. And basically it's a stoplight approach that looks at a few key nutrients in foods. That gives us data as a food bank, so we can say for certain, yes, we're providing foods that really promote and support health. That's backed by a lot of great research, and it's a practical tool that we can then pass along to our partners and then families and individuals that get food from us. So that's been a big project, really exciting for us. We can kind of use it to plan out menus for our programs, and also keeping in mind different cultural and religious and dietary needs that our community members have. So we've worked with a lot of different partners on understanding who's in our community and what types of foods do they typically like to eat. In general, people from different countries have these amazing mix of flavors that they bring to our American diet. And I will say most of the time it's healthier than our American diet. So we want to promote those foods and make our neighbors feel really welcome and have foods that are familiar to them and can really promote their health. And then healthcare partnerships, I've managed several different grants with some hospital networks. Eskenazi Health is a huge partner of ours. They are doing incredible work in social determinants of health. And so part of my role there is working with their medical providers to make sure patients are being screened for food insecurity, and then there's a smooth referral process to community food resources, such as our food pantry network, our home delivery program, and lots of other resources. I love talking about Fresh Bucks with them, farmers markets, you name it. There's all kinds of referrals that those hospitals can make. So every day, just like the other 2 ladies mentioned, is different for me, which is so fun. And go back to you guys here. Stop sharing. My camera froze. Hopefully it didn't for you as well. But yeah, that's kind of an overview of my role as nutrition manager.
Great. Thank you so much, Sarah. And I think one big question that I definitely had as a student is like, how do you get to be you? You know, what does your background look like, whether that's educationally, where you went to school, and how you found yourself in this more of a community nutrition type of role?
Okay. That's a really good question, actually. And sometimes I just feel like I fell in it. I fell into this position. I think just being out there, like I said, I was the executive director for the Indiana Academy of Nutrition and Dietetics for a long time. So relationship building and communication was a lot of the work that I did. I used to work for Open Door, which was a community health center and other kinds of things. So I had, clinical pieces and like how to integrate things into a community setting. And because I knew a lot of people doing different things, I like to be a connector. Certainly this job was even easier to get because a friend of mine, she's now the CEO, but at the time she was the communications director, and she was the one that reached out and said, would you have interest in a position like this? So, I was really just following my interest. I enjoyed the work that I was doing in my previous jobs. It really was just kind of like a moment where I thought, well, is this something that I would really be interested in doing? And knowing that I had sort of that heart for farming and where our food was coming from really made it interesting to me. I knew a little bit about kind of what dairy councils did, because there is one here, obviously in Indiana where I work, but they're all across the country. So I had been to other events that groups had done. And it seemed like a natural fit for me to be able to take some things that I really loved. Working in a community space, so I get to work with different people all the time. I like to do something different all the time. I also, so like Elise was saying, had this little niche. I thought I could not be the dietitian at the hospital all the time. It just wasn't the thing that I really wanted to do. So having a lot of different experiences, I think, sort of helped me to get this position and to integrate into it because it was interesting to me in that capacity. But yeah, I started in community and then just sort of evolved in that way, doing open door. And then, like I said, I contracted for a long time, so I worked for myself. Going in and working at hospitals and long-term care and different places that needed a dietitian in a clinical capacity. But I feel like all of those things really helped to prepare me, because I still understood, you know, if you're the dietitian at the hospital or at the community center or long-term care, like you're seeing different types of people and really getting to understand what their needs are, you know, learning that sometimes they don't have enough money to be able to pay for food, and they need to be able to utilize pantries and banks. And so that's where I think those connections sort of come in. It's like, who do I know? How can I help this person in this way? And which is why it's always so fun for me now to be able to work with other healthcare providers, with other dietitians, with other community agencies to make those connections. So much of the work I get to do, that's just a daily kind of thing. So I don't know. Now I went to Ball State for my undergrad. So I started out, but I was a biology major, was not a nutrition major, but I worked in long-term care in the kitchen. I really liked food service. I liked, you know, learning about like how food could help make you healthier, or when you might be eating something that's not necessarily helping your body and all those kinds of things. And just at one point, the dietitian in the room said, "Have you ever thought about becoming a dietitian?" And I really hadn't at the time. So I went through my didactic program at Ball State, and then I did an internship, because to be a dietitian, you have to have an internship and then you sit for an exam. And I did mine through a distance education program. They're more common now, but they were less common back then when I started. So again, it gave me sort of that, because it was not set up through a school that was here local, I had to do a lot of legwork kind of on my own, and again, make connections and networking. So just all sort of evolved, and I was very fortunate that there were other dietitians around me in my jobs before I became a dietitian that were very inclusive and wanted to help me along the way. And so to me, that's why we take interns. So like Sarah mentioned that they have them at Gleaners. Sometimes our interns are working on similar projects or doing something together, which is kind of fun. But I love being able to work with students. We've took some public health interns the last couple of years as well, because I feel like that expands my knowledge of what they're learning and what they know, which can only, you know, better the work that I do. So again, being able to work with students is always fun. They can help us do more. We have an office of 8 currently, and we take care of the whole state. So we have to share information and provide things a little bit of everywhere. And it's impossible for just 1 or 2 people to do that. So it's kind of been an evolving process, but really an enjoyable path to getting to where I am. So I've been a dietitian almost 20 years, which honestly hurt me just a little bit to say that. Because now I feel old, but it's been great fun.
Your experience, you're providing so much wisdom.
I'm trying, I don't know.
Awesome. And I know someone just hopped in, so I just wanted to make sure we were all on the same page. We're answering a question right now about just backgrounds and how our panelists came to be where they are, more of in a community nutrition type of space. So go ahead, Elise.
Yeah, so I think I'll be curious to see how this trend goes with newer generations entering the workforce, but I was lucky enough to stumble into public health nutrition. Like, that's what I wanted to do early on. And so my background, my undergrad, I went to IU Bloomington and got my majored in public health and minored in nutrition, and then stuck with it. And so at Bloomington, I was really involved with Mother Hubbard's Cupboard, and they so I was able just doing some of that nutrition education, and then I was an advocacy intern there, and really just liked that type of thinking about, you know, not just how are we feeding hungry people for now, but how are we kind of changing systems and creating different ways for folks to long-term have access to their basic needs. And so luckily, like, knowing that, I've been able to have a diverse sprinkling of experiences. So I did an internship in Washington, D.C. at the Food Research and Action Center, and they do advocacy on child nutrition programs. So I kind of got to see, how does this nutrition knowledge get translated into policy? I did a year of AmeriCorps service with what's called the Healthy School Corps, and it was working on school health wellness, and I was in Brown County, Indiana for that. And then I knew I wanted to do a gap year between undergrad and going back for my master's. And so that was kind of that gap year. And then I did my master's of public health in nutrition at the University of Michigan. And that's where I completed my dietitian training, classworks, and then did that coursework. And I was someone who was really on the fence of, do I want to become an RD? Because I knew, like, I'm not working clinically, and just had been advised by several mentors, like, this is something that once you get it, you'll have it forever. And it just adds a lot of legitimacy to the work you're doing if you know you want to be in nutrition. And I think I've been working for 3 years, so not a long time, but I can see that there. And so I think I would just something, obviously, if you're not there, that's totally fine. But that I would advise, like, if you're thinking about next steps, that thinking through, is this something that you'd want to get, is really a worthy thought process, because, as you know, I think there really is a growing field of public health nutrition, and we need nutrition experts who kind of understand both that metabolic and why are we making the recommendations we do with the public health approach of, well, what's the lived experience of how people are able to kind of put those two pieces together. So it was a good decision for me. I don't regret that at all. And so then since then I did my MPH internship, I worked at the state of Colorado, their public health department, working on some baby-friendly hospital and breastfeeding initiatives. So background, it's like I got food pantry, policy, school health, state health department. So the good news of kind of knowing I like this area is I was able to dabble in many different little parts, but knew I really wanted to work at a local health department after my MPH degree. And so I've been here doing that, living that out, which has been a great place to grow. And I think the good thing about, you know, being at an organization like this is there's a good bit of flexibility for that growth. And so it's been fun to kind of flex different muscles that I've gotten to do. And job options. So I will say state of Michigan has really kind of pioneered nutrition incentives. They've got a program called Double Up Food Bucks, and they're kind of the best, or just an example nationally. And so being in Michigan for grad school, I was aware of this. And so I think the really cool thing is, as we are working on some of our statewide efforts, or just thinking about sustainability and growth, being able to, I know people who now work for what's called Fair Food Network. And so kind of having those personal connections helped me, totally helps me today. And so I think, just thinking about diversity of experience, it really does kind of culminate together to help you in whatever type of position that you end up in.
Absolutely. I know I also have my background in public health as well. And I always used to say public health is great, but it's also the worst because you can do so many things with it. And this is such a special part of public health, that nutrition piece for sure. So thanks, Elise. Go ahead, Sarah.
Yeah, I was just thinking through while these ladies were talking, kind of what even led me to study dietetics. I went to Purdue University, but I think my passion for nutrition and nutrition education kind of stemmed from my mom. She was always gardening and taught us how to cook pretty young. She was a consumer family science major at Purdue, and she works for Purdue Extension currently. So she does nutrition education for her job, and I did 4-H growing up, took the foods project, and just love that connection of how food impacts health. So I did some research and found that Purdue was one of the top programs for dietetics. My whole family went to Purdue, so I was kind of destined to be a Boilermaker, I would say. But then while I was there, I got introduced to a dietetic internship program in Peoria, Illinois, kind of fell in love with it. Loved that there was an option. You could do clinical or community as your emphasis. So definitely a clinically heavy program, but I chose to do community as my last half of the program, just from different volunteer opportunities I had had in high school and in college, volunteering at like soup kitchens, food pantries, was just really interesting to me, and it felt like such a necessary part of our community. And sometimes the foods you would see there are not the healthiest, and so I think there was always kind of that interest there in the back of my mind, but I honestly didn't know that working at a food bank could be an opportunity for a dietitian. And I will say it actually is fairly new. I think Gleaners is still the only food bank in the state of Indiana that employs registered dietitians currently. I've talked to a few that are kind of working their way towards that because they do see it as a really valuable asset to the team. We have 2 RDs on staff at Gleaners, which is amazing. So my supervisor is an RD with a lot of different background in clinical, retail, communications. So I think having that diverse education is a really great asset to any team, honestly, but especially for a community organization. We can't just keep kind of doing the same thing we have been doing for years and years when it comes to food insecurity, because we still haven't figured it out. So we have to be innovative, and we have to look at food insecurity from lots of different angles and different partnership opportunities. So I think the dietetics education I received did prepare me really well for that. We have that medical, that scientific background, so we know that we're research backed in things, but we also have more of that personal approach, taking time to look at individual needs and barriers. And so when I started looking for jobs, I definitely wanted to stay in the community field. I remember a specific point in my career or in my internship where I was doing this cardiac diet education like for the 30th time that week on the cardiac floor. Like, love cardiac dietitians. I think clinical is so important for that acute need. But I just had this realization that wouldn't it be great if this patient wasn't here in the first place? Like, what if we could change their habits and their surroundings so that they never had to come to the hospital and have a triple bypass surgery or whatever the case was? So I think that solidified for me. I love being on the preventative side and the management side. So let's keep you out of the hospital by making sure you can maintain a healthy lifestyle. So honestly, it was just a total like meant to be moment. Right when I graduated my internship, Gleaners posted this position for the nutrition manager. They had never had this position before. I'm from the Indianapolis area to begin with, so I was looking around my hometown, and I really think it felt like it was designed for me, so I applied and just like crossed my fingers that it would work. So this is actually my first role out of my internship. Still blown away that I got my dream job right out of the gate. I know that's like not the norm, so don't panic if that doesn't happen for you. But it has been neat to see how my roles evolved over the last 5 years as well. So there's lots of lots of opportunities. And like I said, more food banks I've talked to are interested in hiring nutrition and public health professionals. So this is a really exciting time to be entering the field if that interests you.
Absolutely. The field is just growing and growing. And that's part of why we wanted to do some series like this, is just for people to come on and just share how important it is that this field is public health, nutrition, and just community nutrition, because it is such a soft spot in all of our hearts. And we're wanting to raise up a group of people who also share that. So it's so exciting. We've talked a lot about like what got us interested, some really exciting things that we have in our work, and what we wanted to dive into next was some challenges that you might face in your area of the state that you serve that you think would be helpful for the group to understand and know before entering into the field.
Gotcha. Good question. There's, I guess, a few things. Probably for me, one of the largest challenges is because in the association that I work for, it is statewide. And like I was saying earlier, there's only 8 of us on staff. 3 of us are dietitians, which is unusual. I mean, there are lots of dietitians all across the country who work for dairy councils, but to have the ratio of amount of dietitians on staff is unusual. So the fact that we have 3 of us is great, but we work in 3 very different roles. So, you know, the CEO is doing business and management. We have another dietitian who's working more in school food service and kind of helping K through 12 schools with their needs. And then there's me, who's trying to help communicate all the messages. So it's really just, you know, how do you get information out to people? How do you connect with people? And the best way for us to do that is through partnerships, because we can't possibly be everywhere. So that's a huge challenge. Sometimes there are things that we really want to do, but we just can't, because we either don't have enough person power, you know, to be able to do it, or maybe funding. Like I said, for us, we are a not-for-profit and we're fully funded by dairy farmers. Everything we do has to be science-based. So, you know, we make sure that all the T's and I's are dotted and crossed. The USDA makes sure of that. So we have great information, but maybe not enough partners to always do. And so I think that's a challenge. Probably another thing for me that I suppose what keeps me in a job is how much misinformation that there is around nutrition. There's just so much. You can find information everywhere, and probably you can find a piece that maybe, you know, somebody wrote, and if that identifies with whatever your belief is, you're like, yes, this is what it is. But if you really break down the science, it's not always true. And the same even just for agriculture. I never thought as a dietitian, even knowing I was coming to a group that works in agriculture, that I would be talking so much about dairy farming, like helping people to understand like how it is, because there's so much misinformation. So it's a huge challenge, which is why we try to take that science and break it down into like fun little videos or something. I just never really thought about that in a community space. You know, when I was doing my other jobs, it was more of, you know, are there handouts or webinars, or, you know, what is it, a cooking class? Like how can we provide this education? But now when attention spans maybe are a little bit shorter, or we're super busy in our, you know, work, personal lives, that we can only take things in smaller bits, it's really taking that information and trying to make it very succinct and usable. So it's a challenge sometimes to do that, making sure that it's credible information, and that it's appropriate information, but in a way that is actually useful for somebody, that they could read it or hear it or see it and be like, oh, I didn't know that. So those are a couple of my greatest challenges really in my work, but it's what keeps us doing something every day. Challenge.
It's very true. How about you, Elise?
Yeah, so I'm going to start with kind of a challenge slash soapbox of things of we, if you didn't know, Indiana is ranks really well in certain measures. Like we've got some good, you know, I think we're #1 in like popcorn producing. Like that's cool, and we've got some good for economic growth. We have some pretty terrible health outcomes. So I think just there's some real struggles of, you know, the whole point of my job, probably a lot of us on this calls, we care a lot about these health things. And so we also are a really low funded public health state. So my soapbox, and folks who are at UIndy might already know this if you've got Heidi as a professor, but there is the Governor's Public Health Commission is up this year. And so there's, you know, some opportunity to invest in public health and kind of build up across the state structures that help and support healthy behaviors for everyone. And so I think that kind of touches on two barriers. One being, you know, there is this really high need, and there can be some low funding. And so that can make it difficult to really do all that we know we would like to do, that we can read these best practices and see, we know this thing would work here. If only we could have, you know, the staff or the funding or some of those things to implement it. So I think there's also that within that, there's this need to communicate why this is important, right? And so if we know we're in a state that where business and economic development is really key, like how can we make that message that we know good nutrition leads to health, and good food access can lead to healthier individuals and healthier workers and drive down, you know, business costs and all, you know, all these things. But it's kind of how do we connect those dots to the people who make those decisions, I think can be a challenge, kind of big picture. And then kind of a little bit more specific to FreshBucks in my role is both this kind of sustainability / growth of the program. So, you know, what we do is we provide a dollar for dollar match. So people are spending real dollars on fruits and vegetables, which means we need real dollars to give out to people. And so we're in a spot right now where we've got some really good funding for the next couple of years, but it's like, well, in the next, after 2024, like we have $0. And so some of that planning of we want to grow to more locations across Marion County, across the state. Like we want everyone to have access to this, but how do we get, you know, whether it's state dollars or foundation dollars, how do we share our story well and share our impact well so that other folks with dollars want to give us that money so that people can have access to the healthy foods that are nourishing for their lifestyle. And then there's some fun, like complex, like I'm in Marion County. Can I only focus in Marion County? Can we grow out? So there's some of those, I think they're fun conversations going on now too about some of the growth and how does that look from an organization standpoint. So challenge, but I think growth. And then I think the final thing is in this work, I think there's really important work being done about how do we frame food, how do we frame health and nutrition. And so I think there's really important growing awareness of this. We've got to get beyond personal choice, and so how do we think about, you know, I care a lot about health and nutrition, and I want people to live a flourishing life, and that no one needs to, health is not a value anyone has to have. That's a choice. And so just because that's important for me does not mean it's important for a neighbor or someone I'm trying to help and all of that. And so, you know, how do you create these opportunities and ways for people to come alongside where fits with their lifestyle that's not kind of paternalistic or shaming and things like that. And I think overall, you know, we have come in some important ways, but I think there's that continual education of like, we're not the food police. We're not saying you can't have X, Y, or Z. We are just hoping to like improve options and give you more choice in what you can afford and what you can choose to buy. So I think those are the things that came to mind for me.
Wonderful. What are your thoughts, Sarah?
When I was thinking about challenges that I see in my work, I just kept coming back to the complexities of barriers that community members face, especially when it comes to eating healthily. So you think about like this ideal picturesque vision that you have, like I'm this dietitian, I'm coming to the food bank, we're gonna make everyone is going to love eating healthy foods all the time. But then you get into the realities of inequities in our built environment, and you get into transportation challenges, and you get into language barriers and federal policies that prevent people from getting what they need. And just, the list could go on and on and on. And sometimes it feels like when you solve one problem, then another issue pops up. And so reminding yourself like to not get discouraged by all these things, but looking at what's the one thing that I can do right now to improve the situation, maybe even just a little bit. So thinking about maybe someone who's experiencing homelessness, getting a bunch of fresh produce is probably not super practical for them. So what's something we can provide? An easy open can that is satisfying, and then also a referral to a community partner who can help them with something beyond just food. So I think it's been really neat to see how Gleaners especially has been thinking beyond just like, let's keep pushing food out, and then hopefully it gets to the right people. We've been looking a lot more at data, demographics, kind of where are resources missing and where are people gathering, and how can we kind of bring the food to the right people, and making sure it's types of foods that make sense for community members. So more of just an equity approach has been a growing pain. I think it's, it's a lot more background work. It's a lot more intentionality in how we run things, and not just assuming, oh yeah, everyone's gonna love this ham that we're providing today. Like, that may not always be the case. So I think it's getting past like our personal preferences and our personal goals, and really taking a look at what does the community actually need, and what can we provide, and then maybe where do we need to work with partners in the community so we can address things from multiple angles. So yeah, I think a challenge turns into an opportunity in that aspect.
Yeah, for sure. Being able to see it from the viewpoint of other organizations, and then also the viewpoint of community members, is really going to help us to create a more well-rounded approach, for sure. All right, we're going to move into our last question here, and then we'll open it up for questions. But like I said, if you all have questions, feel free to just enter them in the chat as we go. The last question is about advice. So what advice or encouragement do you have for students interested in public health, or maybe just helping with chronic disease, or in this case, public health nutrition?
Let's see. Well, obviously I work a lot with nutrition students, but I have had a chance to work with some public health students in the last couple of years. And really, I feel like just number one, remaining open to all opportunities, because I feel like sometimes we have an idea of what it is that we really want, and not that you shouldn't go after those opportunities. You absolutely should. But if something comes up and somebody's like, well, I can't do this, but I can maybe help with this, or would you want to join me for this particular thing? Just be very open to what those experiences could be, because it's very likely that two things will happen. Number one, you may learn something new about that particular area of public health that you had no idea. And number two, you might actually help to be the educator for the person who's trying to help you. That's a huge reason why I work with students, because I learned something when I'm working with them about their views, and we're all part of the same community. So, just staying open, I think, to what opportunities are out there, and say yes as often as you can to be able to get those experiences and learn a little bit more.
That's a great piece of advice. What do you think, Elise?
So I think something that helps me a lot was being really proactive about connecting with people who you think are doing interesting work. So both my internship at FRAC in DC, I just cold emailed and was like, hey, I think this is really cool. Do you have internships? And same with the Colorado State Department of Public Health and the Environment. I just found an email and they connected me to someone, and it worked out. And so I think that that's not weird. That's super normal. I think that there's a lot of you as a student, you have that to your advantage to really be an explorer and learning. And so if it's an internship, if it's like, hey, I just really like to hear about what you're doing, that's people are pretty open to share about that. I think in going into that, having some specific questions so they kind of know what you're into is also really helpful. And then even things like LinkedIn, when I was looking for jobs, I did a ton of connecting, and people, that's a place where people do post jobs a lot. And then there's the kind of sad but real reality that many people get jobs based on their connections. And so even if there's someone that you don't really know in real life, but they post something that's interesting, message them and say, hey, I'm really interested. Can you hear more about that? Can you help me do that? And kind of form those connections to, I think, both expose you to opportunities and see interesting things. And so, that's not a weird thing. It's not using people. That's a normal kind of part of professional development. And then I think something else that helped me a lot was, think about where do you want to be, and then what skills do you not have, and then how are you going to grow those? Is that something you can volunteer with? Can you join a professor on a research project if it's an interesting topic? The Indiana Public Health Association, they've got a student board, and there's opportunities to kind of network and connect in those ways. And so not only your kind of job experiences, but what are other unique experiences that can expose you to more things that are just interesting to you? And then I think a financial one is if you're an undergrad student now, Marion, our health department, they'll pay for your grad degree. So think about what your future is, and are there ways that maybe you can work and go to school or things like that if you think future education is in the cards or something you want. That is something I wish I would have known. I think I had in my head you have to go right away, and that's not true. So think about that. And then I think something else that has become clear in this work is topic expertise is important, and that's we're all nutrition, we care about this space, but also there's kind of these cross-cutting skills that they're almost in some ways more important, that really thinking about and honing are really important. I think communication is a big one. Can you effectively translate your findings, your ask, things like that in a way that's helpful? And then also, in public health, we're more and more working towards those upstream options. And so, if you're interested in food, do you want to be in nutrition space? Obviously, I love that. I think it's important. But you know what? Wages have huge impact on food access. And so, economic development plays a huge role in that. And so thinking about, this is a really, it's a big field. And so what are the other, what really gets you going? And is that in this space here, or are there other places that you could kind of be a piece of the puzzle that's helping it all come together?
All fantastic pieces of advice. All right, Sarah, round us out.
My advice may sound cliche, but I would say look for as many opportunities to gain experience as you can. One that helps you kind of identify, is this actually something I'm interested in pursuing long term? And two, it kind of gives you an insight on what opportunities might exist for a career in this field. So anytime you can hop on something on campus, or Indianapolis is full of lots of opportunities for, even if it's just volunteering or job shadowing for a few hours, that's a good foot in the door, and it helps build those connections that Elise was talking about. And then with those, I highly recommend keeping records of some sort. It could be super simple, of what you've done in the past. So that's something you can present at a job interview. It's something you can put on your resume. Instead of having to think back oh gosh, I volunteered that one time 4 years ago. What did I do? I don't remember. Including pictures is really great. So I'll give an example. During my internship, we had to make a portfolio of all the projects we did, and it was really tedious, but I brought that binder in with me to my interview at Gleaners, and I showed them examples. I said, hey, here's here are some examples of nutrition curriculum I've developed. Here are pictures of me teaching children or groups of people. I'm comfortable doing that. And my supervisor at the time said that was kind of a selling point for choosing me. Even though I was fresh out of school, they selected me over a couple other candidates who had more experience than me because I had those kind of tangible examples of skills from anything from those hard skills directly related to nutrition to softer skills. I totally agree with Elise, like leadership, communication, teamwork, collaboration, those are all really great skills to highlight, even if you don't have a ton of like technical experience.
Fantastic. Thank you all so much. That information was so rich and so helpful. At this point, we're going to open it up for any questions. So if you all would like to ask anything, please enter it in the chat or come off mute. No one will bite.
I have a question.
Yeah, go for it.
So I am in the Master of Public Health program at UND, and I graduated with dietetics in my undergrad, and I'm planning to do my internship, my dietetic internship at the end of my Master of Public Health program. But I'm kind of struggling with kind of like, I feel like by the time it gets to my internship, I'm going to completely forget about nutrition, which I know that's not true. I'm very like passionate about it, but I'm super wrapped up with public health right now that I just am kind of worried about once I get to my internship, if I need to be like preparing for that more. I was just kind of wondering your guys' advice, like how I can stay involved and kind of keep in the know of the nutrition, even though I'm still kind of wrapped up with public health right now.
That's a good question. I don't know if anybody else has another response, but I guess two things. First of all, I would just continue to read and try to stay connected. At this point, I don't know if it, because if you're not in a dietetics program, not necessarily, students wouldn't necessarily think to become a member of the Academy of Nutrition and Dietetics. Like there's a ton of information there, but it could be as simple as like today's dietitian or looking at Smart Brief, like information that could come out that's going to give you a little bit of that. I'll say my own opinion is you won't forget everything, like you said, Joey. There was a lot more that I felt like I learned in my internship. So just having like things will start to come back to you. I think having that little time span, you maybe are missing out on, that equations, for lack of a better word, when you go to take like an exam, but to do your actual internship, you're going to have a lot of life skill and you're going to have, a lot more diverse experiences than what maybe some interns who are doing it immediately after would.
Right.
And I think that's going to be a skill that you'll have. It'll just be at that point when you go into a clinical rotation. That's probably the scariest one, I would think, or maybe, or food service. If you don't like food service, I don't know. Sometimes that's a scary one. But those I think will come back to you, or it'll be an appropriate time that be like, okay, I'm getting ready to start clinical. And I know in the next coming weeks, I'm going to be on the cardiac floor. Like Sarah said, maybe I need to brush up on some of that information. And then I would make sure that you are a member of the Academy, so that, because you can get a student membership, it's reduced a little bit there, and you can get a lot more information that way. I don't know, Elise or Sarah, do you have any other thoughts to add?
I think my only thought is like, I think it's okay to say what you don't know. And I think people will like respect that, of like, to be honest, like if I was asked to do like a calorie calculation, like I could not pull that out for you. And so I think, it's like, it will leave you again. And so I think it's totally like, it's been a while. Can you like refresh me on what that means? And I think people will be pretty gracious and understanding on that.
Totally agree. I'll just quickly add, I can't speak for your internship program, but mine would provide kind of, hey, here's some things you need to be prepared for in this next rotation. And they'd provide kind of a list of resources to look over and study. And then I'd kind of chat with interns. I was like, hey, you did this internship or this intern rotation before. What can you tell me about it? So yeah, I definitely had forgotten some things by the time the end of my internship came around, but they had those kind of refresher resources that were really helpful for me. So if those are not provided to you, that could be a good opportunity to ask, hey, is there anything you would recommend I read over before I start next week? Just for an example.
Awesome. Yeah, that makes me a lot more confident. That was just kind of what I was worried about. I love studying public health, but I just also want to be able to keep pushing it with nutrition. So thank you guys. That definitely helps.
Thanks for asking. And that's so exciting to have both public health and nutrition. Like that's such a fun space to have knowledge in both. Anybody else have questions?
Quiet
Okay.
group. Julia, do they have contact information for us? Should we or could we share that in case there's somebody that's just, camera shy or whatever today and doesn't want to put their question out there? They could always reach out.
Yeah, absolutely. We will get emails added here. We are very,
Another question.
yeah.
So right now I'm working as a lunch lady at a middle school just because it it's works very well with my schedule, and I know that like looks good and stuff, but come summertime I definitely need to look for something else. But I was kind of just wondering if you guys have any suggestions on jobs that would look good on my resume and also work with my schedule as a student.
If food service is something that you are obviously familiar with, then that could be low hanging fruit. And I can tell you that's where I started, was in food service and long-term care. And so depending on what it is that you're doing in your current job, a lot of those skills may relay over. And depending on the facility, sometimes they're more skilled nursing, and it might just be helping to prep meals or maybe passing meals or something like that. And then there's also hospitals. Just as a side, because a lot of times they'll need extra help. Occasionally they'll need help in like their tech offices, being able to help, get information and, taking those doctor's orders and then getting them into a system so that food service can create. But those are probably two places that they would always be looking for help. And I think somebody with your skill set would be someone that they would generally consider. And I know when I was doing long-term care, for sure, there were very flexible hours. So there might be like 4-hour increments that I could come in and work part of a shift and not have it be like 40 hours a week for the whole summer. So.
Awesome.
I do know that the Indiana Public Health Association has 2 internship options. One is at the Fishers County, or City of Fishers Health Department. I believe the other's in Hamilton County. So if you're able to make the drive up and want to be in the public health space, and I believe those are paid internships as well.
Okay, awesome.
I'll send the link. I'm finding the link here.
Yeah, and I would say it just kind of depends where you're hoping to be in the future. So I get the privilege of hiring our summer nutrition intern every year. And so when I'm looking at those resumes, I'm looking for, do they have experience working with children? Because our program's primarily planning and implementing a child's nutrition education program. So even if it's just like they were a nanny for several years, like that counts as experience in that skill. But if I was looking more for someone who could train doctors in something, that would be a different skill set. So thinking about what you're interested in the future, and then looking for volunteer or intern opportunities in that area. And I'm going to post the link. It's not posted yet, but I'm working on the job description for our summer nutrition intern position. So if anyone on the call is interested in kids nutrition education, it is paid. You get to work with me. It's part-time and it's super fun. We've had a really, really fun time with the interns the past 4 years I've had them. So I'll put the link. This is like Gleaner's general hiring page, but it should be posted sometime in the next like month or so.
Awesome. Thank you guys.
Yeah, of course.
It's one of the best ways to get plugged in is just to network like this. So thanks for asking the questions. We did put everyone's emails in the chat, so you all can grab those if you would like to ask a question offline. Anybody else? All right. Well, thank you all so much for joining us today. Thank you to our wonderful panelists, and I hope that was helpful. I hope that answered questions, especially if you're interested in this, in becoming a registered dietitian or just being in the public health nutrition space in general. So thank you all so much. And as I said, reach out to any of us if you have any questions at all or want to connect for internships or just general knowledge of this space.
Good luck,
Thanks, all.
everyone.
Yeah, good luck.